Welcome once again, 2017 Henry Ford Endoscopic Sinus and Skull-Based Surgery course. This will be the second edition since I've been here. We have an encore from Dr. Parul Goyal. He'll be here today, and Dr. Adam Rourke will also be with us today, so welcome guys, thanks for coming. We're going to locate the anterior ethmoid and sphenopalatine arteries, and then Drs. Rourke and Rock will talk about endoscopic orbital and skull-base anatomy. All right, so we'll start off with the maxillary sinus.
Medializing the middle turbinate here. This is a right nasal cavity, the uncinate here, and then this is actually just moving deeper in. That's actually the bulla there, uncinate here, covering up most likely the natural ostium. Once again in that next section of cells, as well as the skull base superiorly. This is a point in time where you're going to start to identify the natural ostium perhaps.
For this intracranial, intranasal anatomy. If you read those two papers and you have the patience to get through both of them, one's by Al Roten, and everybody knows Roten's papers, this optic nerve here. So, in trying to get you a sense of this top and bottom anatomy from the cranial side.
Endoscopic skull-based surgery really just starts with very thorough and good sinus surgery. And the other critical factor for good endoscopic skull-based surgery is that collaborative relationship we have with neurosurgeons, or in some cases with our oculoplastics colleagues. And we're going to be able to clear that tumor entirely from this area, at least in a gross way. Certainly not microscopic clearance without resecting these structures, but with the tumor on the carotid, that's unrealistic.
Welcome everyone to the dissection portion. We're back. We're just going to breeze through 5 minutes of just rehashing the dissection so you guys see them again. Really take your time today, get the noses cleaned out, identify all your landmarks, think through it, use your dissection manuals as needed, and then ask us questions. We got some great guys here, and females of course, but teaching-wise guys. And so let's start off with the maxillary enterostomy, right? First step of sinus surgery.
The sinus and skull-based surgery cadaver course is a unique opportunity for the residents to apply the anatomic knowledge they've acquired over the years through countless hours of reading various sources such as articles, book chapters, and dissection manuals, as well as through their experiences of shadowing or performing live endoscopic sinus and skull-based surgery. Once they step into the cadaver lab, they take the dissections into their own hands, and while we as educators are there for questions and support, they have complete autonomy over the basic or advanced surgical approaches they choose to perform. Their experience here is really only limited by their level of curiosity and their desire to learn. For prospective resident applicants, please take a look at our department's residency website to get an idea of the opportunities available to you at Henry Ford. And I specifically invite you to view the rhinology content, as well as my YouTube channel entitled Henry Ford Rhinology and Endoscopic Skull-Based Surgery. Here you'll find the full array of basic and advanced endoscopic sinus and skull-based cases we perform here at Henry Ford, and these videos serve as excellent references for residents from which to learn during their residency. Again, thank you very much for watching,